Good day, my name is Millicent. Welcome to my class, and in this lesson I'll be presenting about a learning disorder called epilepsy. What is epilepsy? Epilepsy, it is characterized by recurrent seizures, which are brief episodes of involuntary movement that may involve a part of the body and sometimes accompanied by issues like loss of consciousness and control of bowel or bladder function. And anyone can develop epilepsy. Epilepsy affects both females, males, all races and ages. Seizures can also vary in frequency from less than one per year to several per day. Epilepsy is defined as having two or more unprovoked seizures. Symptoms of epilepsy. Characteristics of seizures vary and depend on where in the brain the disturbance first happened and how far it spreads. Temporary symptoms occur such as loss of awareness, consciousness, disturbance of movement, sensation, mood, and other cognitive function. People with epilepsy tend to have more physical problems as well as higher rate of psychological condition, including anxiety and depression. Learning with epilepsy. Most people living with epilepsy do well as learners through primary, secondary, and further education and learning. Learning can be challenging for anyone, but however, some people living with epilepsy may experience additional challenges in learning, which can be due to their condition or treatment. At times, these challenges may affect some of their expression and goals in life. Some may experience learning difficulties related to conditions, and it can cause diseases such as neurological disorder, genetic factors, and trauma. Also, they will have problem in solving some of the situation they find themselves in, and they will be experiencing memory loss, speech and language, and they won't be able to read very well. Epilepsy impact on learning. Almost all the medication taken affects on cognition, learning, and mood. It is very important when treating seizures in children with learning difficulties to carefully assess the medication used and the possible impact of this medication. Most of the time, kids with epilepsy have a difficulty in learning because of the medication they are taking. Also, epilepsy might impact learning in other ways. Daytime seizures can affect learning by reducing alertness and by interfering with short-term information storage and abstraction. Frequent and uncontrolled seizures impair learning new information due to the amount of time the individual is unaware of the environment. Nighttime seizures can disrupt the consolidation of memory and affect language function. Epilepsy's impact on learning. Most of the students that experience epilepsy have low self-esteem. Students with epilepsy may feel frustrated and discouraged by their difficulties with seizures. Cognitive impairment can also be a side effect of the various medications used to treat epilepsy. These medications have been associated with learning difficulties, behavioral change, and memory impairment. The drug most commonly is implicated with behavior, which can cause behavioral problems. Also, they can be delayed when it comes to academic journey. Students' academic journey may take longer than other students because most of the time they are very sick, they are experiencing episodes, so at times they don't have time to attend the classes. Strategies to use for learners with epilepsy in the classroom. As teachers, we should maintain a calm tune to keep students from panicking. And when one of our students they are experiencing epilepsy, we should make sure that we control other students so that they don't panic and they understand what is happening with the other student. We should reassure and comfort the student if they are experiencing confusion or fear following the seizure. We should make sure that the student is feeling safe, and we should always comfort the student after they experience the seizures, because at times when they wake up from the seizure, they're very confused, they don't know where they are. So we should make sure that we comfort the student. We should allow the students to remain seated in the classroom until awareness returns. As teachers, we should make sure that when another student is experiencing seizure, make sure that we control the class so that the other kids can remain seated and we can explain to them whatever it is happening so that they don't become so shocked and they start to panic. And also we should give students extra time on tests. Those who have epilepsy, they tend to be very slow, so we should make sure that we give them extra time when they are writing their classroom activities or tests. Also, we should record lessons for students to revisit. So we should make sure that if they have missed a class, maybe they are sick at home, we record the lessons so that they'll be able to catch up. We should allow the students to remain quiet and rest time following the seizure. We should make sure that after a student has experienced a seizure, they sit down and they rest, because when they wake up, they're very confused, they don't know where they are. So we should make sure that we give them time to rest and explain to the students what had happened and help them to understand what is epilepsy. Also, we should use syllabus arrangement. Arrange sheets that covers the lesson for students to use in class when taking notes. The sheets can have a blank space for students to fill in the information keywords. Also, we should use technology and support tools. This can be enjoyable and hands-on, giving students a simpler and more engaging approach to learning. And we should choose how to respond orally rather than in writing. And these are the references. Goodbye and thank you.